Living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
We trust them with our lives, yet many of us find it difficult to have open, honest, and frank conversations with our doctors. With me today is Dr. Thomas Royer. With more than 45 years of healthcare experience as a clinician, clinical leader, physician executive, and health system CEO, he's here to help us become courageous consumers of healthcare services. I'm Lisa Sather, and this is Healthy Living for Life. Stay tuned. One of the many hats today's guest has worn is that of a clinician. Welcome, Dr. Royer.
Thank you. It's a pleasure to be here, Lisa.
Thank you. Thank you for joining us. So in preparation for your visit today, we asked a random group of consumers in our area to send in questions they felt that would help them become courageous consumers of healthcare. So are you ready?
I am ready, and I would just add this is such a pertinent topic for this time, and I would stress two reasons, Lisa,
Yes.
to your audience. Number one, a study was just reported out of Johns Hopkins by Dr. McCary in the last year, which indicated that medical errors are the third leading cause of death in the United States behind heart disease and cancer. I mean, think about that. But on the positive side, actually, the value equation, which I will explain briefly, is actually driving healthcare in this last year and a half, not only driving healthcare from the standpoint of quality, but also because of payment. And the value equation says we must do everything to improve quality and safety, patient satisfaction, and that's the numerator, and underneath is we need to stabilize or reduce cost. So that's forcing healthcare to be patient-centric versus hospital-centric or provider-centric. So indeed, the patient has a much more important role than they've had in the past. So this is so timely, and thanks for having me.
Oh, perfect. Great. So first question. There's a fear among patients that if they disagree with their doctor or challenge their recommendations, that they may risk making their doctor angry. So can you explain to us what's the best way for a patient to have this conversation with their physician?
Well, first of all, I would say if they make their doctor angry and he gets or she gets very angry, probably it's not the right doctor in the long term. But to begin, certainly there will be times when you need to have that difficult discussion. I would say, first of all, be very professional. Explain why you're taking the position you're taking, why you're having a different opinion. Hopefully provide data for why you believe something is different, whether you've heard it, whether you've read it, and just in a calm way, ask the physician for their response to that, and just wait and see what they say. I would say that good physicians will not find that to be problematic.
Great information. So along those same lines, when patients want a second opinion, for example, they fear they may be questioning their doctor's judgment again. And what's the best way to talk to your doctor about getting a second opinion? And second part to that is, does that put a black mark on the patient-doctor relationship if I say, hey, I need a second opinion here?
Yeah. Well, unfortunately, I have worked with many physicians over the years, some of whom resented when patients asked them for a second opinion. And I would say again what I said on the first answer, they're not the right physicians for you in the long term. I think clearly you need to be able to ask for a second opinion, particularly if your case is complicated, or again, you are seeing data which might say there might be a better approach, or there could be an alternative approach that you want to look at. So again, just be open and honest and say, I would like a second opinion. Good physicians will encourage that. I have all my career. If I was telling a patient, making recommendations, telling them what they needed to do, and they looked pensive or somewhat anxious, I would say, you know, this is a big step for you. Go get a second opinion, and let's see what that says. And let's try together then with that information, another voice, make the best decision. So again, if the doctor resents it, too bad, seek another physician. But don't avoid asking for a second opinion if you really believe it's necessary.
That's great advice. It makes complete sense. So another question here from our viewers. So let's say I'm getting a surgical consult for a heart condition.
Yes.
Are there things I should do ahead of time to make sure I'm seeing the most capable surgeon for the procedure?
Probably that question is even maybe more significant than the first two, because clearly a surgical procedure has more significant potential negative outcomes than a medical diagnosis. Not always the case, but certainly. There are two ways, Lisa, for today that people can actually get documented information. The first is on health grades, which you can find on the internet. The second is Yelp. It's a free service, and I am discovering now 90% of the people who call me for medical advice still, usually other colleagues about their parents, have already looked on Yelp. And you will see not only 5, 4, 3, or 2 stars, but you'll also see written recommendations or concerns written by people who have accessed these services. However, once you're talking to the surgeon, it's very important to say, how many of these procedures have you done? Number 2, what is your mortality rate? Do you have any deaths? What is your morbidity? Do you have any complications? What are your positive outcomes? What's the return to work rate? Do you ever have to bring back people for another surgery, for a complication? What's your infection rate? Good surgeons will answer those questions for you.
Wonderful. Well, thank you. We have about just a minute left before we have to take a quick break, but just quickly, if somebody wants to dismiss their doctor, do you have some advice that you would give them on how to do that?
Yes, I think merely calling the office staff and just say, for obvious reasons or for numerous reasons, and you don't have to explain them, I have decided to change physicians. What I would like would be a complete copy of my medical record, and I would like that both electronically, if you have it, as well as in a written form. And I would also like those records not only given to me, but to be sent to the physician, and I'll give you his name and address when I get it.
Great, thank you so much. We're going to take a quick break, and up next, he'll answer more questions from our viewers. Please stay tuned.